Hi there, my name is Dr. Elliot Lessig with Arise Chiropractic Wellness Clinic, and last week in my discussion I talked a little bit about a really intriguing topic called piezoelectricity. And so this week I want to follow that up as promised with a little bit of a discussion on inflammation, basically what causes it. And I want to spend a little bit of time turning the concept of inflammation on its head, as a lot of our conventional views on inflammation, in my opinion, are a little bit misguided. And so what I want to do is talk a little bit about what causes inflammation. And there's a multitude of causes, but I'm going to cut right down to one of the things that we as chiropractors see very often in clinical practice, and that is the physical, mechanical causes of inflammation. And so obviously, if you have an accumulation of stress in your life, whiplashes, falls from horses, falls downstairs, as a little baby you may have fallen off a crib, forceps deliveries, vacuum extractions, generally birth trauma can be a major cause of spinal imbalance. But usually what we see is that there's an accumulation of many stresses through people's lives that by the time they arrive at our doorstep, a careful history will quickly reveal that a multitude of accidents has led to the imbalances that we end up detecting in the exam. And so these imbalances in your vertebra, they can actually cause an underlying inflammation that begins. And the reason that your body and your cells execute this very obvious pattern of inflammation as a result of these imbalances is that inflammation is your cell's ability to bring water into the area, to swell it, to bring heat into the area, to get more blood supply to that spot, to create a fire alarm, so to create pain in the area so that you're kind of aware that there's actually a problem there. Oftentimes we see there's this redness of the area, which is just a result of that extra blood supply. And this is all created so we can pull in these very powerful sort of immune cells, these white blood cells that clean up the trash and create scar tissue and help to clean up the damage and the sandpapery sort of gunkiness of that joint. And in the acute sense, that's a very, very healthy response. It's a healing response. It's exactly what your body's designed to do. It's an innate response. But if that's left as an imbalance and it just goes on year after year after year, we start to see this show up as arthritis. So arthron meaning a joint in Latin, itis meaning inflammation. It just means that your body has been executing this very healthy response over and over and over and over. And these valves of inflammation, if they're left on for too long because the imbalance has never been corrected, we start to see that showing up as arthritis. And on x-rays, it shows up as bone spurs and sandpaperiness around joints. And that leads to a loss of joint integrity and a loss of function. And so what patients are most concerned about is the pain. And so if we just keep plying the body with medications, if we just keep taking anti-inflammatories and painkillers to mask those symptoms over and over again, you're not only going to create a toxic problem for the body where the liver and kidneys have to work overtime, but you're never going to solve the imbalance itself. And I always tell my patients, you can't really help to solve a physical imbalance with a chemical solution. Just kind of a funny way of saying, you're going to have to tackle it with a physical solution if you really want to see those imbalances right themselves. And so our job as chiropractors is to help identify, first of all, where the imbalances are, and then begin a process of gradually, very healthfully restoring the integrity of how those joints are meant to be aligned and meant to move. And then your body's cells do a wonderful thing. They actually turn off the well-executed healing response that they've always needed, and slowly we actually reverse the damage of that inflammation. It's no longer needed. And that's why chiropractors experience this wonderful success rate with everything from sprain strain issues to little babies who have the inability to feed on one side because their neck kind of gets pinched, or maybe it's a migraine and neck pain and headache sufferer in their 30s as a result of a whiplash injury, and you name it. And so if we can put all our efforts on reversing the imbalances that are causing the inflammation rather than just addressing the dis-ease component of inflammation itself, then we can actually be much more successful at overcoming the imbalance and bringing that vitality back to your body that it so often needs. In practice, we see patients with 4, 5, 6, up to 10 postural imbalances And I see arthritis, this inflammatory response, showing up in x-rays as early as 10 years old. So inflammation in the long term that shows up as arthritis is not something that you see necessarily in old people. It's not an old person disease. It's an imbalance and pressure-based disease. And so my job is to identify that as early as possible, and of course eradicate it and turn the valves of that inflammation off so they're no longer even needed by the body. And just a little different way of seeing it. Next week I'm going to talk about the 3 T's of nerve interference. And so we'll talk a little about what causes nerve interference and why we're so successful at reversing it, and how we can actually cause a much more crisp firing of how your nerves work inside your body, and how that lends itself to better health. So I'll look forward to that. In the meantime, if you're a patient of mine, I'll see you next week for a powerful adjustment. If you're not a patient, we'd love to meet you. Thanks for your time.